Hello, hello. Bit late this evening. I apologise unreservedly for that. We have got some questions to answer, got some things to answer to. 4 things which I'm going to try desperately to remember what those 4 things were. And I'm going to just recount them now. We've got, can I have surgery if I've got low platelets? Inverted nipple correction after having breast cancer. Discharge around the nipple for breast reduction. Oh yeah, stockings after, how long to wear the stockings for. Okay, so I'll go through those things, but if there's anything live, feel free, and I will be checking to see if there's any live comments, and I'll be happy to answer those as and when. So what we've got is how long to wear the compression stockings on the legs. Now these are stockings that everybody who comes to hospital gets. They're called TED stockings, T-E-D-S. I guess strictly speaking should be TED stockings. Anyway, it's thromboembolic deterrent stocking. Anyway, stops blood clots forming in your legs. They wear them when you go on long haul flights and things like that. It's just compressing the veins of your legs, because you can get, when you're not mobile, you can get blood static in your veins. That can then clot and form what's called a DVT, deep vein thrombosis, which can then, which can then fly off to your lungs, cause a PE, which is a very serious condition and something that we are, which we worry about. So we do everything we can to avoid that, and TED stockings is one of those things. For me, they're on during surgery. Often we use these Flowtron boots during surgery, and really it's till you're mobile. The best thing to stop DVT is to be mobile. So don't rely on your TED stockings, get yourself mobile, and as long as you're mobile, that's the main thing. So I always say to patients, when they're mobile, they can stop wearing the stockings, which basically means when they leave hospital. Having said that, the hospitals often have a policy, and I think they say 2 weeks. So the nurse will probably tell you on discharge, you need to wear them for 2 weeks. So, whatever. The fact that this patient's asking the question means that they don't like wearing them. So I think if you're mobile, it's fine. Just keep your legs moving if you're not doing anything, and I encourage you to mobilise. So yeah, for me, 2 weeks, and keep moving. But if you're not very mobile, then maybe you better keep wearing them. Question 1. Question 2. I look like 3, 2. 2 was platelets. Can I have surgery if we've got low platelets? Yes, you can. There's all sorts of medical conditions. People have heart conditions and all sorts of things, and they worry that they can't have surgery. And it's just like anything. It's whether you have surgery or not, you've got to balance up the pros and cons, and this will be another thing to balance up the pros and cons if you have got low platelets. The main thing I'd be interested in is, does it affect your daily life? Do you have problems with bruising and things like that? Do you have problems with your clotting? Because if you are troubled on a daily basis with it, then maybe it would be telling you that you have a high complication rate. I don't think they've specified what surgery it is, but assuming it's something relatively big, like a general anaesthetic type surgery, some kind of breast reshaping, something like that, tummy tuck, then I would say that we'd have to balance up the pros and cons and have a discussion whether that would be right for you or not. But it's not an absolute contraindication. It's something that we could discuss. And yeah, we have done... we have this all gone black and white, and I've got some sunglasses. Well, hello. Look at that. That is good. Look at that. It's all right. I'm just trying out my masks. That's nice. So, yeah. Not an absolute contraindication. We'd certainly discuss it, and we wouldn't say no just because you've got low platelets. The other thing we would do is talk to the person who's looking after your platelets. So if you've got a haematologist or something, I would suggest you talk to them, and we would write a letter to them to say, look, she's thinking of having this surgery. Is that okay with you? Is there anything we need to do? Any precautions we need to take? Or, things like that. So we'd have a discussion with the other doctors involved in your care. Question 2 that was. Now question 3. Inverted nipple, that's right. This patient has had breast cancer. She's had surgery and radiotherapy, and her nipples have become inverted, and she's saying, can I have an inverted nipple correction? Now the answer to that, again, very positive this week is yes, you can have an inverted nipple correction, no problem at all. The only thing that I would slightly, a little bit sort of alarm bellsy is, oh, what's happened there? Oh my lord, raise your eyebrows. Where is my eyebrow? Right, okay, sorry, I'll get this off. How do I get this off? I get it off, do I press it again? Okay, can't get it off. Okay, the only thing I would say about someone who's having who's had breast cancer in the past, oh crikey, is that is that inverted nipple can be a sign of breast cancer in itself. So certainly, if someone's got a new inverted nipple, if there wasn't inverted before and it is now, then you'd worry a bit about breast cancer. If you've got a history of breast cancer, you might think, oh, is that a worry? Well, it is a worry, but it's perfectly reasonable that the radiotherapy and the surgery might have caused the inverted nipple. That is a reasonable thing. But I would say to you, it would be best to get checked by your breast surgeon, whoever's looking after your breast cancer. I'm assuming they sort of know about it. If they don't, it's probably best to talk to them about the inverted nipple to check there's no other reason for the inverted nipple. But if it is just the surgery that's caused it or the radiotherapy that's caused it, then you could have a correction. Anytime you have radiotherapy, that creates scarring, and that's what the inverted nipple is. It's the scarring of the ducts that pull the nipple down. When you do surgery, you create more scarring, and this is something we talk about when we do inverted nipple correction. So there's always a risk of recurrence because the nipple can get pulled down again. And if you have radiotherapy in the area, then the risk of recurrence is going to be higher. You've got more of a risk of wound healing problems, but I've got to say, the thing about inverted nipple correction, the scar's almost invisible. It's at the base of the nipple and you can't really see it. So that's not a big deal, but if you've got scarring in the area, there's a risk the nipple could invert again. Perhaps more so than someone who hasn't had radiotherapy. So yeah, two things, high risk of recurrence, and just check with your breast surgeon that there's nothing that he needs investigating for the cause of the inverted nipple. Now we're on question 4. Question 4 was, oh yes, discharge. It's something like discharge, I think it said around the nipple or something like that, or below the nipple, 3 weeks after a breast reduction. Is this normal? Now, this is my patient, so the first thing I'd say is come and see me. We'll have a chat and we'll have a look, or send me a photo and I'll have a look at it and just check on things. But it sounds like obviously there's an incision around the nipple and down, and whenever you get two scars meeting, whenever you get a T-junction, and when you do a breast reduction, there's a T-junction at the top of the vertical scar and at the bottom of the vertical scar. So there's a circle, it's like the anchor, you know, circle, line, and then, so anytime there's a join of two scars, like a T, there's a risk of wound healing problems. It's more common at the bottom of the T-junction, I've got to be honest, but sometimes you can get it at the top of the T-junction. So it might be that maybe a little bit hasn't healed up very well, and that's what's weeping. I'm assuming it's the wound that's got the discharge rather than the actual nipple that's discharging. I'm assuming that. Nipple discharge is would be unusual following breast reduction, but certainly discharge from the wound. And you can, I always say to people, I aim for the wounds to be healed in 2 weeks, but it can take longer. And we're 3 weeks in now, so there might be little bits that ooze. Usually just give you some gauze to wear in your bra. It's not normally a big problem. The worry, obviously, with any sort of big surgery like a breast reduction is things like wound infections and breakdowns, but you can usually see that. Dawn, I will wave back at you if I knew how to use this machine, but oh, look at that. Oh, you're not waving, you're watching. It says waving. Sorry, I thought it said you were waving. Oh God, embarrassing. Anyway, wave to your Dawn. Hello. Oh dear. Yeah, 3 weeks post breast reduction, a little bit of discharge. Well, I'm assuming it's a little bit of discharge. Is not a big problem, but as I say, just give me probably the best thing is to give me a call and. Or come to the clinic and I'll have a look. Or send us a photo or something. Oh, thanks, Caroline. If I could like that, I would. Oh, yes, I can. There you go. Can I? Have I liked that? Oh, yeah, I think I have. Yeah, can't wait to do your surgery in April, Caroline, assuming it's me, or maybe it's someone else, in which case, good luck with it. God, what was I saying there? So, yes, that's answered that question. So a bit of discharge after 3 weeks after breast reduction is okay as long as the wound's looking okay. There's no signs of infection. If the wound's not looking okay, if there is signs of infection, let us know. Give us a ring, drop us an email, show us a photo, etc., etc. So awesomeness. That's me done. 4 questions I think you'll find has been answered. Starting to kick off here. So I am going to check out of this broadcast, but I will be back next week for another one. So if you have any questions, please let me know, and I'll be very much looking forward to answering those questions. So excellent, thank you very much. With me, of course it is, Carol, of course it is, I know that. I don't know why I said what I said. I know it's with me, and it's going to be absolutely great, and yeah, looking forward to that in April, Caroline. That's a 2018 good thing that's going to happen. One of the many good things, but certainly your surgery in April is going to be right up there with the events in 2018. So good. All surgeries with me. No, we've got Kuram Khan. So Shona's got a live question. Are all surgeries with you? Is the question. Kuram is a surgeon, a plastic surgeon who works at the Children's Hospital, and he does the local cases, local anaesthetic cases, mole cysts, the clinic. We're trying to expand and get him to do more of the GA cases, which will be at the Priory Stroke Parkway. But at the moment, he's concentrating on the locals, which is on site, the theatre on site. So if you've got a mole cyst, it could be with me or Kuram. But if it's a GA type thing, so a breast thing or a tummy thing, yeah, it'll be with yours truly. So I hope that's got that one. And nice to see you here, Shona. Glad you could make it. And I'm sorry I'm late for this. So yeah, that's uplift. Yeah, I can do that. I can do uplifts, Shona. So yes, that would be with me. Oh, unless it's in London. Unless it's in London. Sorry, if it's in London, it's Paul Tully. Sorry, I should have mentioned that. Paul's our surgeon in the Harley Street Clinic. So if it's Birmingham, it's me. If it's London, it's Paul. If it's a minor rock in Birmingham, it could be Kuram, but we're trying to get Kuram to work at the... See you in March. I'm booked in for a consultation. Awesome. Well, it will definitely be me. We don't do any of this, see someone in the clinic and then operate by someone else. Whoever you see in the clinic will do your surgery. So if you're seeing me in March, it will definitely be me. Yeah, that's the way we roll. So yeah, excellent. So we'll see you then. Looking forward to seeing you in March. And I'm going to vacate this theatre now. So good. Actually, you know what? I'm going to do that. And I'm going to do another one. So excellent. Thank you very much for being here for me, and I'll see you next time. But oh, who did that? Bye.